Hi, my name is Amanda Sims. I am a nurse practitioner student, and I'm here to talk to you about your new diagnosis of ankylosing spondylitis. I know that that's a lot of big words, so I'm here to kind of talk to you a little bit about what that means and the symptoms and diagnosis and treatment process of it. So, ankylosing spondylitis is a type of arthritis. It's caused by inflammation, or the pain is caused by inflammation, the symptoms you're experiencing. It's more likely to happen in men than in women, and typically the symptoms start in late adolescence or early adulthood. So, one thing that you might have noticed is that your symptoms have gradually gotten worse. That is pretty common. It has a pretty slow onset. And you might have noticed that things are starting to just get a little bit more difficult, a little more painful, a little more persistent over time. That's a classic sign of ankylosing spondylitis. We don't actually know what causes it yet, but we do have some very effective management techniques for it. So the symptoms that brought you into us today is the pain and the stiffness that you've been experiencing in your low back. So ankylosing spondylitis typically affects the spine. You've started to probably notice that you're not able to bend forward as much, move to the side, and twist around. We call that range of motion. So ankylosing spondylitis causes limited range of motion, and then the pain and stiffness in the back. You might notice that it's worse in the morning or after rest. That's pretty typical. Physical activity tends to make it better, but it is hard to move when you don't feel good, and we understand that. So it's also difficult to sit up or to twist your spine, is a classic symptom. As the disease progresses, you might become a little bit more stooped, and sometimes it might be difficult to place your feet. So some people develop a little bit of a shuffling step. That can happen because of the joints in the hips, which is also how we were able to diagnose for sure that this is what it was. Through your x-ray, we saw some abnormalities in your hip joints. That is a classic sign of ankylosing spondylitis, as well as the symptoms that you've been experiencing. Typically, we say if you have had pain or stiffness in your back for 3 months or longer, that's usually a good sign that that's what we've been able to diagnose. So we also notice that you have limited chest expansion. That is another way to diagnose it. And those things could potentially get worse if we don't start to treat it right now. So what we'll be doing for you is throughout your treatment, we'll be monitoring some lab tests. We'll just check your blood periodically to make sure things are not getting out of control. And then obviously we're going to be watching your pain and your stiffness and range of motion. So your treatment will include physical therapy. We want to try to preserve as much range of motion in your spine as we can. So physical therapy is a big part of that, but we do know that you're in pain. So what we prescribe typically for that is something called an NSAID, and that's a drug that you've definitely heard of before. I'm going to have you take some ibuprofen before you do your physical therapy. That will help decrease the inflammation in your joints that's causing you pain and make it easier for you to do the physical activities that we have for you. As the pain progresses, and it probably will, we want you to keep on top of that and let us know, because if that's the case, we also tend to do steroid injections into your joints to help you manage that, and they are very effective. I also have a referral for a support group that we're going to give to you to help you kind of cope and deal with your diagnosis. There's a lot of people that really benefit from that if that's something you're interested in. And then if it gets to this point, we'll discuss this, but we may need to do surgery eventually. Not everyone has to have it, but if we do, we'll discuss it as we get a little bit closer. Do you have any questions for me?